Our you can, or I can. I'm going to call today's meeting of the Children's Trust of Alachua County, our regular board meeting to order. And I ask the clerk if she please call the roll to ensure we have a quorum.
Member Andrew.
Present.
Member Lavarga. Member Cornell.
Here.
Member Hart. Member Ferrero.
Here.
Member Peterson.
Here.
Member Chance.
Here.
Member Twombly.
Here.
Chair Sir.
Here. So we have, seeing that we have a quorum here physically. Is Dr. Hart online today?
Please not.
Okay. I have to deal with that. Agenda review, we have some changes to our agenda today. And it was already told to me. So what we're going to do is we'll have the consent agenda, general public comment, the chair's report, which is none, and then we're going to insert what is currently items 11, 12, and 13. I'm sorry.
10, 11.
We're going to do items 10, 11, 12, and 13 after the chair's report. And then the remainder of the agenda will do 9 and 14 after that. Okay.
Thank you.
In that order.
That have,
So can I get a motion to
with that, with the changes as recommended.
so have a motion by member Peterson, second by member Cornell to for our agenda as modified. Is there any discussion, any comments? Anyone else want anything moved? Any public comment? No, seeing none, all in favor? Aye. Any opposed? Thank you. All right. Our consent agenda, that is there. Motion to approve our consent agenda.
So moved.
Thanks. All right, any public discussion? Any consent agenda items? Any board discussion? I see none. All in favor? Aye. Opposed? Okay. Thank you. We're now at the time for citizen general public comments for items on our agenda that are not on our agenda. You'll have 3 minutes to speak to the board. If you would please come and queue up at the mic. If you give us your name, and the clerk will function as our timekeeper. Go ahead. Yes. Yes.
Thank you. I am sorry I was unable to attend the meeting prior to this. That's the fun life of having multiple programs. So I did have an opportunity to listen real quick in the parking lot before I came up here, some of the discussion of the meeting earlier, and there were some data points that I wanted to share that had come up that you guys didn't have answers to that we have presented at prior meetings, but I just wanted to make sure that it was clear for today's discussion. So just real quick, this is just down and dirty facts. Alachua County births, about 60% are white and 40% are non-white. Of the families that we served in newborn, 52% were white and 48% were non-white. So we are serving a higher proportion when you look at it through the distribution of raised by births. As far as household income, about 18% of Alachua County, the household income is less than $35,000. Of the families that we served in newborn, 34% of our families had a household income of less than 35%. There was a question about or discussion about why the families are declining. Of course, there are people that do not want you in your home. I don't want people in my home sometimes, right? But when you have needs and you're willing and open and see the benefits. So a lot of it for us is really trying to make sure that people understand the benefits of the program. And when they do, they are so appreciative of the services that we have provided. We have not received a single satisfaction survey that came back in a negative way. Everything was just, I wish everybody had this. I wish this was in every county within the state of Florida. When we tell them it's only in Alachua County, they just don't understand it. They don't understand why not everybody does it. So it's really just kind of breaking through that barrier of getting people to accept it. One of the other major reasons that we hear why people aren't accepting is it's not their first baby, or a lot of them are in the medical community with North Florida or HCA North Florida with Shands. There's a lot of people in the medical community in Alachua County, and they don't feel that they need the services because they are experienced in that area. We have been able to have a lot of our nurses and physicians who have expressed that concern accept the program, so that we can say to them, this will be your opportunity to share with your patients your experience to see if it was helpful or if it was beneficial. Again, nothing but positive feedback after that happens. As far as the family partner at Women's Group at North Florida, we have had huge success since moving over to Women's Group. So what that person is doing over there is introducing the newborn home visiting program as well as other home visiting programs. And we do this similar with our over the phone program called Connect, or Coordinated Intake and Referral. I just want to put this into context. The success rate of our Connect representatives when they're doing this over the phone is about 60–65%. With our family partner, or you guys call it the maternal partner over at Women's Group, last month it was like 90%. And typically it's about 80%. For those who register for the newborn home visiting program, last month it was 80%, and typically it's averaging about 75%. So there's huge success there. And the majority, if not all of our women, attend their postpartum visit, and that's where we identify those high risks for preeclampsia. They're willing to open up to our nurses about their issues and their concerns, and we've had tons of physicians thanking us and promoting the program for how wonderful it is and the impact it's having on their patients. So thank you.
So Julie, if you would wait, Member Peterson has a question and I have one.
Thank you very much. We appreciate it. So out of how many are born in Alachua County? How many children born? About 2,500, 2,600?
About 26, 27, it depends on, yeah.
Okay, and what you're saying is the ones either that are, this is at North Florida as well as Shands, correct? The
Yes,
newborn? Okay,
yes.
so your success rate that you're seeing there is about 80% of the.
No, what I'm saying for that 80% is the family partner at Women's Group who is registering
Okay,
them. This is not the family partner that's at the hospital. I'll have to pull that data if you want that data.
and you said, I thought I heard 75% in there, so that wasn't for the hospitals. Yeah, I'd like to know what's going on in the hospitals, if you don't mind.
Yeah, we report that monthly, but I'll pull that up and bring it to you guys.
Okay,
And the question I had.
I haven't seen, we don't see that monthly, so I'm not sure what's happening there.
Okay.
But thank you, I appreciate it.
Absolutely, yeah.
Nancy Hart. Okay, Nancy's joined. Okay, good. I had a question, Julie, if you could, you gave us the percentages of the births that you're seeing. I mean, could you tell us the numbers?
So. Sorry, I'm trying to pull this up from reports that are hard to are you asking specifically for the maternal partner or for newborn?
You told me 60% of the births were white, 40% were non-white.
Yes.
And you said visits were 52% white, 48% were non-white
Yes.
of the visits, but you didn't give us the numbers.
I don't have the number on me right now. But I just had the percentage from the presentation that we did at the last meeting where we presented. So it didn't have the numbers in that. I had percents, but I can pull that too. Like I said, I was just trying to pull this while I was sitting over there.
I mean, what you were saying was a higher percentage of folks you are serving are for those folks that are non-white versus the total population.
Correct. So if you look at the distribution.
Yeah, so I get that, but
They're two different programs, correct? I'm sorry,
Yeah.
Madam Chair.
Yeah.
So
different programs.
the numbers you're providing are for the coordinator, what's the term we're using,
The first numbers, the percentage in the distribution of race and by income were for newborn home visiting program.
okay.
The second points that I was making were in regards to how successful the maternal partner is at Women's.
At Women's Group.
Mhm. So
Okay.
there were two different points.
Right.
my question. Okay.
And I am happy to present and bring any data you guys would like.
My question was, which I had the same concern, that was repeatedly, was the number of visits that we were doing and for what we were invested. And I'm glad to hear and to see, or to hear from you, that the demographic data is trending upward for the contacts. And it seems that we are targeting, you said 18% of who we're visiting were low income, considered low income, incomes less than 35,000. So that was what I had. But I would like to see that. I can go back and try to pull out if you guys could let us know the date that they sent because it would be in that, in the packet. I'll go back and review that.
I just have a question, I'm not sure. I know the question, but do you have a higher percentage of interaction with people if they've had prenatal care start, like if you've already, if their doctors sign them up, they're more likely to let you come in and visit them afterwards versus you meet them for the first time in the hospital?
Yes. Yes, so we've been doing a lot of outreach. So when we have their prenatal care provider, their OB discussing it, and even at the practice that we're at, and we sign them up when they're pre-registering, then they're much more likely to follow through because they're familiar with it. It's not being presented to them the first time at the hospital.
But you are still presenting these people at the hospital.
Absolutely. So our family partners go to the hospital every day. They're given a list of all the Alachua County residents. So we have to have a very tight relationship, obviously, with the nurses of the hospitals to be able to get that list of Alachua residents only. That's who we can present the program to, and then we go in and offer it to every single. And then I also just want to add, the visit's not the only thing that newborn does. So when the family partner is in that room, they're doing a lot more than just saying, would you like the newborn home visiting program, and have a nurse come out and see how you're doing, check on you and baby. If they need a car seat, they're doing that. If they need a pack and play, they're doing that. If they need WIC, they're doing that. If they need diapers, we're handing them out. So there's so much more that's going to it than just a
So
piece of
even if they
paper.
refuse you coming to their home, they're still possibly getting some benefits from the program.
Correct. And if we go to the home, we just had a story last week, twins, low birth weight, needed special car seats, didn't know how to install them. We found a counterfeit car seat 2 weeks ago. We took that back, installed a proper new car seat for that family. We're doing the community CPR, infant CPR, and safety classes. There's so much more that is happening beyond the home visit numbers that you guys are seeing. It is a lot. And we would be happy to bring some of those physicians that have spoke highly of the program here to share with you their thoughts, their experience, the nurses. I think the
I don't
community.
need
really
that. I just like to
appreciates
hear
it.
what else you're doing, though. I think it's nice. I think you're doing a lot. I would love it if
There
you
is
could
a
give
lot.
us a report on everything you're doing, even if you're not getting into the home.
Thank you.
Anyone else have any questions? Okay, thank you.
I appreciate your time. Thank you so much.
Yes. And so Dr. Hart, Julie, would you come? I'm not sure if Dr. Hart wants to ask you a question or not, but would you wait just in case she does? Dr. Hart? go
Yes, I
ahead.
do. Hi, can you hear me?
Can y'all unmute Dr. Hart or?
I'm unmuted on my computer.
Unmute. We can't hear you.
There's something we need to do so we can hear her. Yeah, she's not muted.
Hello, 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 hello. Can you hear me?
Give us a second.
Ashley to the rescue.
Oh, yeah. Dr. Hart,
Yeah.
okay,
We can hear
we
you.
hear you now.
Hi, Julie. I haven't had a chance to hear one of your presentations or talk to you for a long time, but I have kind of a question or two very much related to Chair Certan's question, because as a board, we're really trying to figure out how much it's costing us to do each home visit, how much it's costing us to give each one of these services. And I'm always a little bit confused when we ask you a question about how many, which is kind of bean counting, and you answer us with anecdotes, which are fabulous and interesting, but as you know, to be persuasive to our taxpayers and to us as a board, we need not only data, we need stories. We need them both. And I've had a persistent question ever since the program started. What is Newborn doing to address the problems? And it sounds like what's going on, and I'm not sure, I know who this women's group is. Is this at North Florida?
Yeah, it's Dr. Harris's practice.
Okay, so for those of you that don't know Dr. Karen Harris, she's a huge, like me, a huge proponent of this program. And she will manage her residents and the residency managed deliveries in such a way that every mom will hear enough about the program that they'll be likely to sign up. It doesn't surprise me at all that you're having that success in her practice over at North Florida. I guess what I wonder is it possible to have that much success over at UF? And is there a way you can have a nurse family partner in the OB clinics at UF? And I know there are a billion of them, and they take care of a lot of patients who are from the county and some patients who are not from the county, and you'll have to discern all of that. But I guess I kind of share Certain's concerns that we spend a lot of money on this program. We love it. We love the concept of it, but how much are we really getting back for our dollars spent? And let me just give an example. I thought, and tell me I'm wrong if I am, that the NICU was responsible and the OB service was responsible for sending people home with car seats from the hospital. I thought they weren't allowed to dismiss a baby from the hospital without a car seat. Am I wrong about
They no
that?
longer have the ability to provide them, so they are charging when they even do have them available. They're reaching out to us.
Sorry, they're charging the patient for the car seat?
They do, yeah, they no longer have the ability to just provide them.
Okay, so that's very interesting, Julie. And when things like this that happen at a policy level that you fortunately can address and are aware of, can you let us know? Can that become part of the report? Because in a way, what's happening is March of Dimes or whoever used to fund that program before no longer is, but now the Children's Trust is expected to fund it. Am I right?
It's not just the Children's Trust, our Healthy Start program, our MIGV program, our Parents as Teachers, our NFP, we're all pitching in to make sure that this happens. Children's Trust is part of that.
Right. And as you know, what we are trying to do as the board of the Children's Trust is to create systems that are efficient for these pregnant women and their infants and that work. And if there are ways that we can create efficiencies, like it drives me a little bit crazy that some people are cared for by McVie and some people are cared for by Healthy Families and some people are cared for by Healthy Start and some people are cared for by Newborn RN. And I know that you're involved with almost all of those programs. Can't you advise us ways to make this instead of a patchwork quilt with gaps between the patches into something a little bit more seamless? That's what we want to do as a trust. And if other members of the board think I'm crazy, I'll just be quiet now. But this is what I think we're trying to do. And Chair Certain, back me up if you agree.
Dr. Harris, Dr. Hart, I appreciate that. I completely agree. The challenge is that North Florida and Shands do not only deliver Alachua County babies. And so we have to patch it like that in order to make sure that the families from all 16 counties that we're responsible for have access to those resources. So I am happy to bring to this group whenever we find out something that's going to apply to Alachua County. Typically, the Healthy Start coalitions serve in a similar role where it's our responsibility as well to make sure that there's a system of care and that every family is getting what they need. So that's also part of what we do as a Healthy Start coalition, but I am happy to make sure that we are partnering and that you guys are aware of that. I also submit numbers every month on how many clients we have, how many patients we've seen, how many consented, how many had the visit. I wasn't aware you guys weren't getting those numbers. I have them in front of me if you would like me to share them or if you have any questions now that I have pulled it up.
I'm sorry. You'd like to know, remember Pinkerton said he'd like to know, but I think a more efficient way of getting that to us would be to have staff, because if you submit them with the invoice and we don't see the invoices.
Yeah, we don't provide, I don't know if this is on, we don't provide every month's report for every 60 or so programs that we receive monthly information on.
Right.
Bonnie does a great job at analyzing that, and then we come back to the board and present different initiatives throughout the year. Which is what we did last fiscal year for Healthy Start, or not Healthy Start, you know what I mean, Julie's program. So, but we can provide that information to you at the next meeting.
If you like,
As well as
have
after.
her come back and do a presentation at the September meeting, if you would like that. So whatever your pleasure.
With the pleasure of the board.
I
be
just
to
want to know
do
the
that.
numbers because there was a question about the numbers earlier. So it would be nice to see what the numbers are. So, and then we can decide whether or not we want further, we want to.
Okay, so you have one pulled up, you're saying now, if you want to share with what you have now, that'll.
Would you like from October through June of this year, or would you like all of last year's number? And this is just for the hospital, how many patients have been offered the program and how many have had the visit. This is not all the other stuff that we've done.
So I think October 1, yeah, October 1 to June, this current fiscal year.
Sure. So October 1 through June, there have been 1,819 births. This is fun. We have presented and completed an intake. So that means presenting the program, providing education to 1,234 families. 1, 2, 3, 4. Of those, 796 consented,
How many?
796. Right now, we have 23 of those still pending. So what that means is we're still in the initial phases of contacting them to schedule the visit. And 469 have had the completed visit. Actually, it's 25 pending because there's 2 babies in the NICU still.
And you said 425?
469 have had completed, 25 are pending.
So that's up to 796.
Correct, that consented.
So what happened to the rest of them?
So the way we have on here, 433 declined the initial. So when they either consent or decline, 433 declined, 796 said yes. Once they've said yes, 101 declined the RN once the RN contacted them. And 188 we were not able to find.
How many?
188. That's our biggest reason. They'll say yes, and then we aren't able to locate them. And 22 canceled.
I'm sorry, what did you just say?
So that's scary.
It
Oh,
is.
the
Those,
188.
that's typically what you see in home visiting programs. They're a transient population, they're a high risk.
So have y'all done any follow-up on of the say 600, 100-ish that decline, why they decline?
Yeah, the reasons that I had mentioned before, they don't want
About the
somebody in their
healthcare.
home, or that they are a healthcare professional, or that the primary one is that this is not their first baby.
Okay.
And they know what they're doing.
Okay, so that pretty much
And
counts.
so we typically try to explain to them that every baby's different, things may change, you may have different needs, different resources that you may want at this point, and so we go through those too.
And so the number initially may have been a little bit higher, but y'all talked to, say, that some of the physicians and nurses and said, this is an opportunity for you to see what we're doing. And so you actually got a few of those to consent.
Yeah, and we get some that'll call back afterwards too. So when they decline initially with our family partner in the hospital, we leave the information with them. And then they can call back if things change, if they want it. It's open. We leave it open. I think we go up to 21 days now, 3 weeks after delivery, because otherwise it's kind of outside of the scope. If they do call back past that, then we put them through to our home visiting programs.
Many home visits, did you say? 400 and
469. And this year has been lower than last year because of our issue with the family partners. We have been having trouble keeping those weekend family partners. That's what I mentioned before. Last year, we had a total of 736 for the year of the completed assessments, of the completed home visits.
And of the 18, 19, y'all still give all those people something upon the initial week, right?
Correct.
Thank you.
Thank you, Julie.
Thank you. Any other, come on, Ms. King?
Hello, my name is Candace King. I'm a retiree. However, most of my career was in healthcare in Alachua County. So this will just take a few minutes. I wanted to say, and I'm stimulated to this because of what you're going to be doing your colleague in terms of providing a recognition for Pat for her work. So I wanted to say to you that I've been extraordinarily impressed by all of you with your dedication to what you're doing. Everybody provides a different perspective, which is super cool. But it's very impressive how much you care, and our community needs to know that. So I'm saying this in case anybody's watching, that they know, and staff as well. I mean, everybody in this room is here because they care about children. And I think you all do an extraordinary job of sharing your gifts to this end. So thank you. And thank you, Pat.
Thank you, Ms. King. So if there are any other citizens who'd like to comment, if you would, yeah. And the next person, if you want to go ahead and just kind of queue up, I'd appreciate it.
Good afternoon, Margot Ducana, Executive Director with the Food for Kids Backpack Program. I just wanted to keep you all updated on what we have going on. This is our first week of distributions. We are now up to 42 schools across 4 counties. So we've taken on all 5 schools in Bradford County. We've taken on 7 additional schools this school year in Alachua County, primarily in far eastern and far western Alachua County. So we've got Shell, as well as Hawthorne Middle and High School. And we've got High Springs, Mabane, Irby, Newberry, and Oakview out in the western part of the county. So I just want to keep you updated on what we're doing. We've had a great summer in terms of food drives and making sure we have enough food in to be able to provide these weekly bags. On our first distribution will be going out to the schools on Thursday. I've been on the phone and on email all day seeing enrollments coming in. So we know that we've got lots of chronically hungry children in our community, and we're doing our best in collaboration with our partners in the community like Catholic Charities to make sure that they have the food they need to be ready to learn. Thank you.
Thank you. Anyone else? All right, if there's no other general public comment, I'm gonna bring it back and we'll move forward. Oh, yes, we did receive an email, Superintendent Andrew, Executive Director kind of said that you addressed that. We received an email from a citizen related to school lunches, and not all of the schools in Alachua County are designated as everyone eats free under the community feeding program because of income. So I'll let Superintendent Andrew respond to that. Just share a little bit about what the district is doing.
Sure. Were y'all going to read this into the record, or it's just part of the record?
It's part of the record. It's part of the record, yeah.
All right. As some of you may or may not know, the National School Lunch and Breakfast Program allows families to apply for free and reduced priced meals based on the approved income eligibility guidelines. Students and households participating in means tested assistance programs such as SNAP are directly certified for free meals without an application, so they don't have to go through the application process. Families out there who need assistance with the application process can contact our Food and Nutrition Services District Office, and that number is 352-955-7539, extension 1569. Again, any families that are watching this or anyone that knows someone who needs assistance, have them call our Food and Nutrition Services Department at 352-955-7539, extension 1569. The Alachua County Food and Nutrition Services Department accepts donations to assist the schools not eligible for the community eligibility provision. During COVID, the federal government allowed all schools to feed everybody, and that was pulled back. And that program again is the CEP program, Community Eligibility Provision. And we're working diligently to try to expand that again. However, the federal dollars have been pulled back in a number of areas for food and nutrition services this current budget year. So We do have several local community groups that donate directly to specific schools. You just heard Mrs. Takano mention Catholic Charities and the Food for Children Backpack Program. I'm glad to hear it's in some of our rural cities and towns. Certainly, when I was at Eastside High School, was an integral part of what we did with our children to help them. So in addition, we've received assistance through the school lunch ferry program and are currently working to get additional funding through that school lunch ferry program. I do want everyone to know here in Alachua County Public Schools, there's no student turned away without the FNS team offering them a meal. So if we have children in our schools that haven't been able to apply, haven't signed up, they are never turned away at breakfast or at lunch without being offered a meal by our food and nutrition services team. So they truly love the kids and are acutely aware of children coming through the line and make sure everybody has an opportunity to eat. Thank you, Madam Chair.
Thank you, Superintendent Andrew. All right. Kyler, we'll let you do item 10. Resolution 2023-13.
There are moments in time that they're bittersweet. And this is one of those moments. Dr. Snyder, will you please come forward? So we have a resolution, and forgive me for being seated, but I'm in transition and I can't see anymore. So I need to be able to read. We have a resolution of board member service recognition for Dr. Patricia Snyder. Whereas the Children's Trust of Alachua County was established by Alachua County Ordinance 1808, which was adopted by the voters of Alachua County on November 6th, 2018. And whereas the Children's Trust of Alachua County is required by its enabling law to host an advisory board consisting of 5 statutory members and 5 gubernatorial appointees. And whereas the governor of Florida appointed Dr. Patricia Snyder to serve on the Children's Trust of Alachua County's advisory board on February 14, 2020, with a term ending January 1st, 2020. And whereas Dr. Snyder has fulfilled her term according to the Constitution and laws of the state and in the name of the people of the state of Florida. And whereas the board of the Children's Trust of Alachua County wishes to recognize the contributions which Dr. Patricia Snyder has made to the Children's Trust of Alachua County in the area of early childhood development. Now therefore be it resolved that the Board of the Children's Trust of Alachua County in the state of Florida expresses its deep gratitude to Dr. Patricia Snyder for her time, commitment, and her dedication to the children and youth of Alachua County. Be it further resolved that on behalf of the staff and the board, for all she has done to advance the goals of the Children's Trust, we thank you for your leadership, service, and contributions to the children and youth of our county.
Thank you.
Thank you.
I'll work my way around.
Okay.
Thanks. Yeah. I just want to say to all of my colleagues, thank you for the honor and privilege of working alongside you, and to everyone who's in the peanut gallery, as someone referred to it when I came in today. Not only will I be in the peanut gallery forever, but also all of the people that I am fortunate to work alongside with every day from the Anita Zucker Center, some of whom are in the audience today. We want you all to know that you can continue to count on us as you move forward with everything that we do. So thank you.
Thank you. Thank you. comments, member Cornell?
So I guess we need to formally move the adoption.
We do.
Make that motion.
Second.
And I would just like to say, so this trust was formed by the voters in 18. I've had the pleasure of working with Dr. Schneider, and many of the folks here and watching long before that time. And I've served 9 years. I was elected in 2014, and I can say that it has been one of my highest honors serving with you, Pat. You are an incredible resource to this community.
Pat, I just want to tell you, thank you for shepherding this member through many of the areas that we have to deal with, because you know so much and I know so little. And you've made me a much better board member, and I can't tell you thank you enough for what you've done here, but with the swag center and what you've done there, and you helped with the resource center, and then the child center. And I hope that very much that you've made a tremendous difference in Alachua County. And if it weren't for good people like you, this county wouldn't be what it is. So thank you very, very much.
Anyone else?
I'd like to make a comment. Dr. Schneider, thank you so much for all I have learned from you. You are remarkable. The commitment and dedication you have to the children of this community is beyond most people. And I've seen a lot of people who have a lot of commitment to children. And I appreciate everything you've done to help children before someone like me has to see them. And you really have had an enormous impact. And I am just so thankful to have spent this time with you.
And I had the pleasure of getting to work with you on the Children's Services Board before, as the trust was forming, and the way you thoughtfully gave your expertise to all of us and shared that so willingly. This community wouldn't be the same without you. So thank you so much for all that.
All right. Shane, you had something? Okay. So Dr. Snyder, Ms. Chancey, okay. It's been a pleasure and an honor to serve with you. I think I can't remember when I met you. Anyway, I can't, but I do remember. It seems that there was always so much contention when we first started the trust, because it was the contention between the age groups, and I think all of us are concerned about the young people. Remember reading your name and Dr. Hart's and the folks who started SWAG. So thank you for your work. Ken's the one who's making me choke up because I'm seeing Ken. But anyway, I thank you for the work and for the time that you invested. I'm going to miss serving with you here on the board and for the expertise that you brought. I see Herman and all of you all back there. I think that and believe that you all are just a phone call away, and would hope that you would continue to offer a perspective and advice. And now we can talk outside of sunshine. So you have my number. I can call you and I can ask you a lot of questions, because we don't have to be, we're not hindered now by sunshine since you're not serving with us. But I am really going to miss you. But we do thank you for giving of your time and your expertise with us. And we hope that you would continue to support us.
Thank you for coming together.
We ready to vote?
Yeah, so
All in favor? Aye. Any opposed? Motion passes. Thank you again for your service. All right, on item 11. Update on our strategic plan. I'm not sure who's doing that.
Really, it was, that item is informational. So at our last meeting in June, when our consultants were here, you all had some corrections and really some updates for them. They made a few recommendations, and this was just everything put back into one document. You see, it still says draft, simply because we wanted you to be able to see it at least one more time. And then we will be taking this and moving forward with it as our strategic plan. So really, it was information, Madam Chair.
Did we adopt this after the two consultants were here? We
You did.
Did that,
You
right?
did.
So it's just
Yes.
that, all right. So, thank you for that. Anyone have any comments or anything on that item before we move forward? Program funding recommendation. Actually, before we go there, I actually missed the chair's report before I called for you to do that with that. And I don't really have, excuse me, prepare a chair's report, but I did want to, like many of you all here, I attended one day of the Gun Violence Summit. And the Monday was a really good program. I had some good conversations and I thought a lot of good came out of the tabletop discussions. But there were a couple of things that were said at the end of the summit that just kind of haven't left me. And there was one was, we've had a lot of meetings and a lot of talk. And the other was that the people that are impacted or live in these communities were not in that room. And I think the trust needs to do something about that, be a convener of sorts, or figure out some kind of way to bring these people together. One community member I called this morning, she had a meeting yesterday. I was told right at 200 people showed up at the meeting. People in these from the communities where there's been gun violence around the city and the county. And so I don't know if maybe we'd be the convener of giving some money at some point. I don't know how that would happen, but having law enforcement, community members, folks coming, those who were not at the meeting on Monday at the 2-day meeting. We got to we've got to hear from those people and ask them, let them tell us how we can help them. I mean, there's some talk of things that have been tried in other communities, but I do think we as, as an entity that is the voters approved to provide funds to reach out, and diversionary programs is one of the things that's in that. And if we can divert youth, I mean, we're using a lot of things, the programs that we're doing to try to improve the lives of the young people. But I promise you, it's been, after going to that on Monday and then Thursday, I'm driving home. And the chief investigator from the state attorney's office calls me and tells me, look, this just happened. And y'all need to have folks at the school ready to do this. And so I'm like, I just left there Monday. They spent 2 days with this. And then Thursday I'm driving home and I get this call and he tells me somebody just got shot in Woodland Park. Shut it up. Oh, come on, So I do think we kind of got to figure out some kind of way, to bring all the heads together. And if the folks in the community, we got one who's saying she's got a plan to do this, and so we got to figure out something. That may be the piece that we may get something done.
Just to follow up on that, Chair Certain, I had an opportunity to actually talk to our director at the very end of that meeting. And what actually struck me was that much of the things that were discussed that weekend, we as a board have actually heard through our own listening project. And how we, as a result in the strategic plan, have finally allocated, an amount of money, 10%, which is not insignificant, to safety. And I think the trust probably doesn't need to lead this charge, but certainly needs to be at the table and will, I think, start to look at how we can support some of the programs that are specifically identified by both the county, the city, and the other stakeholders. I will tell you that the county commission unanimously passed a motion last week for our staff to do a budget analysis of every program that would impact gun violence and really violence in general in the community, and how could we maybe look at enhancing some of those. There's many things that we are currently doing. I've asked for some of the city commissioners to kind of pass that same motion. And the city and the county are convening in a joint meeting on August 28th to discuss that. And we actually moved the county's last budget meeting back to September 5th after that meeting. So I would ask that if we could have staff attend those meetings so that the trust is at the table, and as we get into our kind of programming for a brand new strategic area in fiscal year 23-24, the trust can see how it plays a role in what the county, the city, and many other stakeholders. It's not just the county and city. I think it's kind of an all hands on deck approach. But my point is that I think we were actually a little bit ahead of the game through our listening project through that allocation of funds. So those are my comments.
Okay, thank you for that, Member Cornell. We were at Monday, I said, you know, we have more law enforcement in our county than you can shake a stick at. City, county, UF,
Santa Fe.
Alachua, High Springs, and Santa Fe. And six entities that's providing law enforcement, and a good number of those budgets that are, you know, there's a pretty penny that's going behind that, but perhaps a solution, you know, Chief Jones always says, we ain't gonna rest our way out of this, and that may not be the path forward. It may be something that's in, you know, in the minds or an idea with the community, but that is something that I did want to share with us to figure out some kind of way the trust can kind of help with that. And so staff attending that joint meeting, maybe we get something and something come up out of that. That is my concern, is that when we're having this happen with our young people at this age, this is a burden for our whole community. If you have an unsafe community, that impacts everything. Nobody wants to live in those areas. Folks don't want to work in those areas. It means we have to spend even more funding. Folks feel the need to spend more funding on law enforcement, and that's not the solution. So thank you all for hearing me out on that. So we'll go back now. We'll go back to our regular business. That was what I wanted to mention, as it was a very well put together program, the summit, and the speaker, but I don't think therein was the solution, but it was good for awareness. Bring us together.
Madam Chairman, the next item, since we kind of approved it in a
Yes.
workshop, I think maybe since all the members of the public weren't here, maybe we put up the recommendations
Okay.
and we can do the motion again.
Okay.
That way the public can respond.
All right, let's go wire. You ready for that? So you're saying she didn't have to walk all the way through the whole thing all over
The
again?
last slide.
You can
But you
just go
can see the
to.
recommendations and I thought that to the budget allocation, we approved Reverend Stokes' after-school program as well, because we approved, although it wasn't specifically recommended. So I thought maybe we could make 5 minutes earlier, Reverend Pastor Stokes can know that it was approved, so he won't have to be in anticipation of the next item. So.
Oh, yeah, we already approved that. Let's do it again.
So I got a board member up here. I got to my left and my right. That's like, they got some next engagements. I'm just sitting in the middle.
We're just trying to make it easier for you, Reverend Stokes.
Recommendations can be found on the screen now. It was authorization to use 2.5 million of the fund balance. Full year funding for the mental health programs, Pay Center for Girls, PALS, Child Advocacy Center. Increased funding for Dolly Parton Imagination Library, and then increase our after school funding from 1 million to 1.2 to include the expansion to Micanopy.
Go ahead.
If you,
It's so moved.
Second.
okay, so moved by Member Pickerson, second by Member Cornell. Is there any public input? Bishop, so come to the mic if you would, please.
And while he's coming up, Madam Chair, I just think the public would probably really like to know that we have approximately $4.3 million in our fund balance and we're so proud of the fact that we finally know exactly what we have in there, or kind of sort of. So I know y'all are sitting on the edge of your seat waiting to know that. So that's what we got out of the previous meeting.
I'd just like to say thank you to the Children's Trust, and on behalf of the 43 young people that I just left to come here to find out what were we going to do. I want to say thank you on behalf of them. We are absolutely excited about the opportunity to provide a continued service, but for 4 years we have worked exclusively off of volunteers, and to be able to provide employment opportunities for our program is absolutely exciting to me. And I want to thank you all for the consideration and the reconsideration. And thank you all for allowing me to participate in the process. And I think that this shows that the process does work. Though there may be some adjustments, it still does work at the end. And I wanted to say thank you. I also wanted to kind of piggyback, I want to take over now, but you're talking about the gun violence and having, as a pastor, having to sit down with parents in relationship to burying their child, having been on the scene and seen blood on the ground, having to deal with young people who have lost friends due to gun violence. I had literally just left Lincoln and rode by Sugar Hill, not even 15 minutes after or before this happened, then after it happened. And to see the results. And one of the things that we talked about, even at the gun violence summit, was that the summit was not the answer. It was the beginning to resolving the answer. And it never was promoted to be the end all. And I think it's a great start. And I like to see that there's the conversation that's actually now going to be held because the young people do want to be a part of the conversation. Communities do want to be a part of the conversation, but we got to move from the boardroom to the streets where they are. And again, thank you all for your support.
Sure. Thank you. Just member Clemens.
Thank you, Bishop Stokes. You thank us. I think we, and I know I speak for the board here when I say we thank you. The earlier conversation that we had at the workshop, we talked about how not only do we need to fund this, but we need to actually expand the funding in this type of area where we are funding the family resource centers and the entire family in the communities that have really bought into this, the 3 R's that Pat and others have talked about. And so I want to thank you. I will also say that at that summit, Sunday night, we saw that the youth don't only need to be a part of the conversation, they really need to be at the front of the conversation. They're driving it because they're the ones that can also provide us with a lot of the solutions. So for those of you that don't know, Pastor Stokes was one of our speakers at the summit, and you said some really impactful things that were repeated by Commissioner Chestnut the following day. When he talked about how we really have to support the family. That if we don't support the family, then after we're done providing the services, they end up going home. It doesn't work. It's really an entire effort. So thanks for being here. You didn't have to, but we appreciate it.
All right.
I have a question. I'm sorry.
If you will come back to the mic.
Yeah. So what's the process now?
Your staff will be in touch with.
Okay.
Staff will be in touch with. Contract negotiation.
Don't we, I think we should.
Madam Chair.
Yes.
Your motion included the approval of not only the program recommendation, but the separate item for.
Right, so really it's
12 and
13
Okay,
together.
just want to make sure.
Go ahead.
Good afternoon. My name is Sherry Kitchens. I'm the director of the Child Advocacy Center here in Alachua County. I appreciate the board and staff recommendations about continued funding for the mental health programs for a full year. That makes a huge difference in our ability to hire and retain staff, which is really important. If we don't have the staff, we can't provide the services. But I also want to say from the gun violence perspective, you're not only funding with us a mental health program, but a victim services program. We were also a part of the response on Thursday. And when we've got children who've been victimized and we've got multi-generational victimization in communities, folks feel like they're out of options, right? And a lot of people with a lot of broken hearts and a lot of broken families and a lot of a lot of heartache that needs to be healed. And so I appreciate your looking at this as a multifaceted issue. Because we've got a lot of also really young kids that not a lot of guidance about how to address their social and emotional experiences, and being able to have some emotional literacy as a part of that. And so we're here to help be a part of that solution, not only from the victims and the aftermath, but also some of the prevention. So thank you very much for considering us and including us in your solutions.
Thank you, Ms. Kitchens. Anyone else? On up, y'all. Queue on up. Oops.
Good afternoon, I'm John Rollins, President and CEO of Motivate Children of Central Florida. And I have a question more so than a comment. So there were 4 and 5, including Bishop Stokes, that were approved this round. Recommended for funding for the after school. Am I out of place?
There are a total of 6, 7 now with the addition for the
So my question is, do we have the number of how many were approved beforehand? How many existing total after school programs that we now have that are approved by the trust?
prior to 6.
So there were 6 that were approved before and 7 that have been added.
A 7th has been added, so 1 more was added.
All right,
Yes, sir.
1 more was added, so the total of 7
A total of 7.
after school programs.
Yes,
Okay. And 1.2 million.
yes.
Okay. How many students do we have in the city? I'm just saying that there are a lot of other programs that probably are in need of some funding. Who may be doing some of the work, and I understand you got to go through the process. Please don't misunderstand what I'm saying. But I'm curious to know if the reason that we're not getting additional applicants has anything to do with some of the challenges that may be a part of being included. I asked it as a question, not as a statement of judgment. Okay, but we have so many agencies that are out working. We have 7 quota that have been approved. And I could get how many years since 2018 the trust was approved. So in 5 years, we funded 7 programs for after school. Again, this is not a statement of judgment, but just something to think about. Thank you.
Thank you, Mr. Rollins. And I don't know how many applied, but the RFP went out. They sent it to a lot of people. I asked, I think 50 some odd folks.
Our entire list gets
Okay.
it.
The whole listserv.
And there were
Hundreds.
Okay, and then I saw it on the website because I was looking for something else, and I was concerned. I think the stat came back was 11 entities applied.
If I may.
Yes,
Madam
ma'am,
Chair,
go ahead.
It's a valid point. Mr.
It is, that's
Rollins. And so one of the ways we'd like to address exactly what you're saying is by working with the capacity dollars that we're hoping, to use those dollars to help with exactly what you're saying. We're gonna expand or enhance the Center for Nonprofit Excellence to provide support. We may be under a cone of silence, they wouldn't be. So there's additional support that with the dollars, we want to address exactly what you're saying. So we do hear you loud and clear, and we're hoping to address that.
Thank you for that. Anyone else before we pull this back to the board? Okay. I'm gonna bring it back to the board. Okay. Any board discussion? Board discussion, okay. All right, so we'll move forward and we'll vote on staff recommendations for uses of fund balance and the funding recommendations, program funding recommendations. All in favor? We're moving forward with that. Aye. Any opposed? Okay. And Member Pinkerton had to leave. He was going to check on his family number.
That was 12 and 13.
Yes, together. We did those together. Okay.
Yeah, we have 6.
I didn't hear you, I'm sorry.
I just asked if we still have a quorum, but we do.
Yeah.
All right, Edie Kiner, you wanna give your report now? You wanna go ahead and we come back to you after the,
I'll come back.
okay, all right. Next is the Help Me Grow
Update.
update, yeah, and Ms. Belita, next.
Good afternoon. We're requesting the board to receive this update regarding the Help Me Grow Alachua contract update. Help Me Grow is designed so all children have the best possible start in life by providing free developmental and behavioral screenings. Families benefit as Help Me Grow listens to them, links them to services, and provides ongoing support. On September the 13th, 2021, the trust approved resolution 2021-13, authorizing the release of RFP 2021-07. Help Me Grow Alachua. The trust recommended funding RFP 2021-07 to Children's Home Society of Florida on December 13th, 2021. The contract was executed for fiscal year 2021-2022 on February 23rd, 2022. After several contract negotiations, the renewed contract for fiscal year 2022-2023 was executed on April 25th, 2023. Help Me Grow Alachua was intended to be a 5-year renewal contract with implementation occurring year 1. Supports that have been provided in year 1 and year 2 are bi-weekly implementation meetings followed by monthly check-in meetings, assisted with sharing and posting job openings with other community partners, worked collaboratively on marketing materials and a guide with the Help Me Grow Florida team, held contract review and work plan review meetings, shared resource lists, upcoming community meetings, and upcoming community events, offered technical assistance and training, which was offered by the Help Me Grow Florida team, resources and team meetings with Help Me Grow Florida and the National Help Me Grow Florida office.
Offered to let her do it all, but just as of August 4th, 2023, this contract will not be renewed after September 30th, 2023 for the following reasons. Leadership and staff changes that affect the implementation of the program in year 1 and year 2. Key components were never established or implemented, such as establishing 211, healthcare provider outreach, and the leadership team. They did not meet any of their performance measures in year 1 and are not on track to meet any of the performance measures for year 2. The trust would like to thank the Children's Home Society for the time devoted to Help Me Grow Alachua. Questions? And this report is intended to inform the board. Here, any questions?
Any questions?
Yeah, I get, the only question I have is, so the budget was 219,000, 220,000, and so that's all coming back into the, how much of that was spent in the current year? The report on page,
Your tab 5, your
tab
program
5,
report,
page 40 says 0.
they have invoiced October through
Year October through
February, maybe.
February.
And so fiscal is working with them to finalize those payments. They will invoice through, because they have staff who have been working programs. And so they will invoice as they are closing out through the end of this contract year.
But they have not invoiced anything yet.
No, correct. They sent invoices in July and fiscal is working through those invoices from October through about February, March, I believe. And so as Nicole catches them up, to make sure those are correct, they'll be able to invoice on a regular basis through the end of this contract year. So right this moment, we have in the office October through about February or March that we are working on with them. Where your document says 0 is because a check has not been issued.
Are we anticipating spending the entire amount?
No, I highly doubt that we'll spend.
Thank you.
Thank you, ladies.
Recorded those invoices.
Say it again.
look hard at the invoices.
Oh,
They're not meeting any of their guide,
right.
yeah.
The card invoice, okay, all right. And so we skipped over our, well, not skipped, but we kind of moved around and we're gonna go back now to Attorney Swain. Yeah, we can't wait to have you come to us on this. And give us a update on Florida Sunshine. Everyone had their packet and was able to review it, I hope. And I'll ask you that you speak into the mic.
Go ahead and speak into the mic. I'm gonna move it right over here. You have our office's canned dog and pony show on the Sunshine Law. I've given this in various parts to this board at various times. I'll try and be as brief as I can, so I don't bore those who have heard this before. And but cover all the bases for those who may not remember it. The Florida Constitution guarantees that Florida government will be in the sunshine. That covers two things. That covers public meetings and public records. The Sunshine Law itself is normally, people use that to apply to everything, but it really applies to public meetings. We are a collegial board, just like any sort of advisory board would be. Any sort of collegial board in Florida government is required to notice their meetings and provide the public with the opportunity to participate in decision-making. The notice varies from body to body because the trust is an independent special district. It has its own set of notice requirements, which are different than the school board's set of notice requirements and different than the city's or the county's set of notice requirements. That may change if the county ever puts up a web billboard for notice. The county's looking at that, which if that happens, the trust would not be required to, for most of their meetings, publicize them in a newspaper. Right now, they have to be advertised, but once the county establishes a board on their webpage and makes the appropriate findings, other governmental entities can use it. That's a relatively new twist of Florida law. There are certain exceptions to the Sunshine Law. Litigation and labor are two of them. Hopefully we'll never have to test the shade meeting for litigation, and unless staff ever unionizes, you won't have to worry about the labor negotiation. The Sunshine Law applies to any meeting of two or more members of the body. So if two of you want to talk about something that's going to come before the board, that has to be noticed and has to be done in public. If you meet each other in a grocery store and you just talk about the weather or about the good or bad year the Gators are having, that does not count because the board has no authority over that and it's not going to come before the board. Just like presumably when we had the break between 3 and 4, y'all were talking shop board members among yourselves, but just exchanging pleasantries or talking about other things. If 2 board members want to meet or 3 board members want to meet, staff will publicize it and let the public come in and watch the sausage being made. One of the difficult things is when multiple members of the board decide they're going to attend a community function. And we had some headache over at the county about several board members attending the summit on gun violence and how that impacted the Sunshine Law. And what we were afraid would happen would was that we'd have two board members who would be on the same panel in the audience, what have you, and discussing in front of each other their positions. And since that is a topic that may come before the Board of County Commissioners, that is something that implicates the Sunshine Law. As it turned out, we made sure the board members understood the issues and they dealt with it among themselves by not attending the same meetings. And then discussing the issues at a public meeting of their own. And that's really the best way to do it. The other way to deal with the Sunshine Law is one-way communications. And that generally means the first person to get their viewpoint out wins, in that you can't start then discussing it on email or whatever. That is right now, because of our law is lacking as far as modern technology goes. The best advice I can give you is someone sends an email to the group, either because staff did not blind carbon copy you, or because they managed to get all the email addresses together and say, this is what I think about this. Do not engage. That is the best thing I can say. Even if all you want to do is set forth your position without necessarily engaging with the other commission, the other members. This is very important because a violation of the Sunshine Law is a criminal violation. And there have been boards that have gotten in trouble for that. Violations can be by email, by text, by phone, any sort of medium. So just have all your discussions regarding trust business with another voting member of the trust in public. It does not cover meetings between any individual board member and staff. Two board members on one staff member, yes, it would cover that. Individual meetings with staff members, it wouldn't. One of the things that staff cannot engage with is what we refer to as polling, which is going from member to member and saying, well, so far the majority of members think this, what do you think? They can certainly find out what your position is and keep that in the back of their mind so they know what is likely to happen at the board before public discussion. That is not polling. That is just figuring out where people are coming from, making sure that staff is able to do their job, because once you have a public meeting, all bets are off, because votes may change, people's viewpoints may change. The other thing is you can't have a person, staff or not, go from member to member to member doing that. That's called a third-party conduit. And the moment someone comes in and says, well, this person over here, this member says this, just say, hey, you're violating the Sunshine Law. Don't tell me that. Let me see. Okay, I covered that. Covered the next page. Let's skip to the next. The meetings have to be open to the public for the trust. They have to be held in public buildings. You can't, the Board of County Commissioners can waive that requirement. That's an internal requirement of them. It simply needs to be accessible. But the law requires, the trust law requires that they be public buildings as well as accessible. And so that sometimes will take a bit of finessing, like when we were meeting at the Cave building. There was a determination that was better than any of the options for where we could meet at the time. But that needs to be kept in mind when you're talking about having a public meeting. It needs to be a public building, which is not a defined term, so you just have to look at it. Cave building is something that is always open to the public versus a country club, which may not be. You also want to have meetings where there's no barrier to attendance. Luncheon meetings are one of those things that always come up, having it in, if you had a Rotary meeting in just picking on Rotary, having it at a public meeting space, and they were having a luncheon, even though someone wouldn't have to buy lunch, that is seen as a barrier. So having that sort of thing is frowned upon. Minutes have to be taken. They can be recorded, but they have to be transcribed soon thereafter and made available to the public. I did mention the opportunity for public comment before issues are decided. How you do that is really up to the individual board. The Board of County Commissioners has two general public comment periods during their meetings. And then they have public comment on every item. You don't necessarily have to have public comment on every item, nor do you have to have 1, 2, 3, however many general open comments. You just have to give people the opportunity to have input into the decision. So the way the trust does it, by having general comment at the beginning, and then having people open comment on each agenda item, that's perfectly fine. The library, for example, does things a little differently depending on who's chairing. If it's someone from the city of Gainesville, they'll do it more like the city of Gainesville. If it's someone from the county, they'll do it more like the county. So it just varies, as long as at some point before the decision gets implemented, the board is given the opportunity to hear from the public on that, because the board can always change its mind. So even if you voted on something, you can still have public comment that says that was a dumb idea, and let me tell you why. And if a majority of you agree, say, oh yeah, we shouldn't have done that. You can change it. So there's always that opportunity. Your notice requirements always have to provide the name of the board, the location and time. As I said, manner of advertisements, the regular meetings have to be advertised a certain way. Other meetings are a little more flexible. So the workshop could be more flexible than this meeting could be. Reasonableness is a function of the law, because the minimum amount of time for a board meeting is a month, whereas the minimum amount of time for a regular meeting of the county commission is as little as 5 days. So it just varies by the specific body. And the fact that the county commissions is not set by statute, other than reasonable, and the trust is set by statute. Any questions on the sunshine law?
Has anything changed? So Dr. Hart can participate, but she can't vote.
Right.
Okay, that's still the same.
That's still the same. What happens there, and that's a good point. That's not in the outline. During COVID, the governor, by executive order, allowed collegial bodies to meet all online for a period of time. The general sunshine law requires that you have to have a quorum to do business present. So what happens is that what can happen is that if you have a quorum available to open the meeting and someone has COVID, or they're recuperating from an illness or some other justifiable reason, the board can find extraordinary circumstances exist and vote to allow that person to participate and vote. Otherwise, the board policy is that the individual can participate in discussion. They simply cannot vote. So we've had individuals have medical issues, and that is viewed as being extraordinary. And we've had people that are just out of town, and that is not viewed as being extraordinary. But you start from the standpoint of you have a quorum. Because if you don't have a quorum to open the meeting, you can't conduct any business. And right now, because we have one resignation, we have 9 members, and so a quorum is 5.
So you have to have 5 to open the meeting and find an extenuating circumstance, and then they can vote. Otherwise, they can elect to.
Once we're back up to, once we have 10 positions filled, the quorum will be 6. Any other questions? That's sunshine. Public records basically is a little more simple for the most part. Anything that is written in any form. Spreadsheet, email, text, reporting. Of course, handwritten, typed. Book, minutes, video recording, those are all public records. If they are reported, documented, taken down in the course of the business, the governmental business of that particular body. So if we're recording this right now, that recording is a public record. Now, there are 2 parts to the public records law, whether something is a public record and how long that document has to be retained. Once the public record of the recording is transcribed into the minutes, the recording is no longer necessary. It's been superseded by the minutes. Perhaps wait until the minutes are approved, but it's been superseded by the minutes. The recording can be disposed of. However, if you have not gotten rid of a document, it remains a public record until you do. And the state archives has a schedule of how long you have to retain to any particular public record. Whether something's a public record is based upon the content, and not the medium. So that's why we have all sorts of ways now that we can make public records. And they're all subject to someone requesting copies of them. And large chunks of government have people that half-time, full-time, that's their job, just to keep track of public records requests. And the trying to suss out what's a public record and what isn't sometimes can be difficult, especially when you deal with emails, if you are a government employee, because the law basically says that not every email you get as a government employee is necessarily a public record. If I got an email from my brother saying, hey, I'm going to be in town next week, do you want to get together? That's not a public record. Unless he says, hey, I'm going to be in town next week. Can you hook up a meeting for me with Commissioner Cornell? Then that's a public record. Now, there may be, and this is where it gets really hinky. There may be a policy against my getting personal emails. That doesn't turn that yet into a public record. But if I'm investigated for getting personal emails, and they find that then becomes a public record because someone else has turned that up in the course of their investigation. It's very important to people that are not in government that you always, and I would just say it's very important for everyone on the trust, that when you do any business for the trust by email or text, you copy a staff member. That's so they have a record of it, so that if anyone makes a public records request, they can find it. Right now, the trust is on the county's, uses the county IT for services, and the county never gets rid of emails. We can go back to the early aughts for emails, because like many governments, we can't figure out a way to get rid of what is out there. So we just keep buying more hard drives
Wow.
to add on. And sometimes we get huge records requests that turn out to be gigabytes of emails that then have to be reviewed. But it's very important that you don't become your own public records custodian. Whatever you do, you always copy staff. You always copy the executive director, Christie, so they have a copy of it, so that if there is a public records request, you are not put in the difficult position of saying, oh, I deleted that, and then Gmail deleted it for me, because Google's not going to have it. And if that was one of those things that should have been retained, they're going to come after you. And again, they're criminal penalties. And there have been various elected officials around the state that have been prosecuted for public records violations because they destroyed records.
Welcome to the board.
Often from, yes, I'm looking at you, often from using their own personal emails. Now, it's perfectly fine to use your personal email, just copy staff. And then they have it and they can be found. As I'm not going to use the magic language.
So can I just ask a clarifying question?
Yeah.
So use my personal email as opposed to what? It doesn't seem appropriate to use my work email for the trust business.
Well, I'm not going to tell you what's appropriate for your work email or not. At the moment, I don't believe the trust has emails set up for board members. So
what is the alternative?
the alternative is personal email but again,
You can have it.
you have some governmental people here who have governmental servers who are in a similar situation in that emails never get deleted. So it would be inconvenient if we had to go to the courts and say, we want Judge Ferraro's emails with this topic. Or go to the school board and say, you can share servers. But we could, because they have an IT department. Google is much more difficult.
Well, it raises a good question, Bob, though. So like I have a county email, that's one they use. You have a court email, that's one they use. You have a school board member, you have a DCF one, you have a superintendent. The gubernatorial appointees, I mean, why can't they have a trust email?
They can. Ashley just said that. all of us could. I just didn't want to have a second email
Yeah.
account.
So I guess if you don't want a person, use a personal email, you can establish
But if I do use a personal email.
copy staff.
that
Copy staff. Right.
In communication with.
Anything to
Staff
do, well, you don't have to copy staff from your emailing staff. But if, for example, someone in the community is emailing you regarding something, or they want you to come and talk to them about trust. Just copy staff so they have a record of it. And that's it. You don't have to copy a second person if you're sending it directly to the trust.
Yeah. Okay.
Yeah, like sometimes people will send me stuff on county or trust business to my personal email. I just forward that to staff, to my county staff, or in this case, to Christie or to Marcia.
Yeah, one copy is enough. I will tell you, as someone who has gone through emails for public records production, there are often 20 copies of one email. A lot of times people get copied and all those CCs show up in a public record search. So it's just, you only need to make sure that staff is copied one time. If you're emailing staff, it'll end up in the IT black hole of emails, and IT can pull it out. They have someone over there that just does these searches routinely. When it comes to public records requests, it is best to refer those back to the trust, because they know how to respond. There's a policy on it. The trust has a staff member, wave your hand, staff member, Ashley, who takes,
Actually, getting all the jobs.
who takes care of those. She will pull all that together. She will ask you any questions like, have you sent us everything? Do you have everything? This covers things you may have received if you go to a conference and you're given materials. Just make sure staff gets a copy of those. Let Ashley make the determination whether something needs to be retained or not. Because like I said, it's oftentimes government holds on to things more than they should just because it's sometimes easier to do. But in any case, let her be the records custodian. Now, your notes you take during a meeting, if you are using those for purely personal reasons, to jog your memory, those are not public record. If you are using them to base an interview on later, then they could be public record. So it all depends on what the purpose of those notes are. If you use those notes later in a public discussion about the business that happened, then those notes can become public record. But as long as they are used for your own personal means, they're not public record. You don't have to create a public record if one does not exist. Look for it, if one doesn't exist, and we simply say, sorry, one doesn't exist. Any questions on public records? Avoid texts. Texts are very difficult. If you get trust-related texts on a personal phone, take screenshots and email them to Marcia or Ashley or someone. If all they're doing is reminding you about the time of a meeting, that's less important than if you're getting input from the community about something, because someone may make a public records request for texts that you have. In the county, we have, for county-owned phones, we have software that goes in and scrapes the text, or we have IT come and take the phone and download everything on it. And again, having had to go through someone's texts in a huge public records request, I can tell you it is painfully dull. So please, please, please just avoid those if you can. If there are ever any questions, I am the staff counsel for the trust. I will be happy to answer them if Ashley can't. Ashley's a go-to, I'm a go-to. Finally, voting conflicts. The thumbnail is you cannot choose not to vote on something that's simply uncomfortable. You can't recuse yourself unless there is a legally identified voting conflict. And that's basically, oh, the trust wants to do business with a relative or business with my company. That's basically the only time that you can refuse to vote on something, with the exception of our judge, who by statute cannot vote on setting the millage. And that's when she can't vote, that sets the quorum down one. Otherwise, you have to vote. And if you don't vote because of a recognized conflict, there's a form you have to fill out with the state of Florida. And the document in here goes into some issues about what's a monetary conflict, special private gain or loss. Those are all very specific. I think the long and short of it for what the trust deals with is just don't do business with someone that is your relative.
Bob?
Yes.
Board treasurers, board members, if I'm a member of this board, but I may be a board member of a nonprofit. And if they do business with the trust, I try to recuse myself. So go into that so we can.
One, it depends. It depends because there are some special rules for board members of nonprofits as opposed to employees of the nonprofit. That's one of those things that if you're concerned about, let me just do a bit of research rather than trying.
But you're not financially benefited is one of the tests, right? You're not financially benefited.
Right, that's what he's told me in the past. I didn't financially benefit, so I was unpaid.
Well, and that's, you're not paid, you don't financially benefit. And again, because it's a nonprofit, there are special voting rules. You just disclose it. And, say, hey, I'm on this board. But I think there are some situations that will make you uncomfortable that you cannot recuse yourself for, that you simply say, look, folks, I have this over here. Let me just be perfectly honest. This does not rise to the level of a legal conflict in the state of Florida, but I have this. I'm letting everyone know so they know where I'm coming from. But again, there has to be a special benefit to you or a benefit to your principal. And again, being the board, if you were an employee of a nonprofit, I'd say it's a little different than being a board member of a nonprofit. But I will, once again, if I know it's coming, I will research it. Otherwise, I just will grasp the legal straws in my head.
Well, I just voted on for them to receive funding.
Well, good.
So that's what you told me in the past, so.
And if I told you in the past, then it was good advice then. It's still good advice because I can tell you the law on that has not changed. It's just if I know it's coming, I'll do some research. But that's one of those things that is I won't say it's knife edge, but it's one of those things that you have to dig on. You have to go to the Florida Commission on Ethics, because one of the things on the ethics law is it doesn't have to make sense. It just is. Voting conflicts, the best practices, follow your gut, ask first, disclose, because then I can say you have to vote. And if your attorney says you have to vote, then you can say, hey, I had no choice. My attorney said I had to vote. Sometimes we've had people that because of their conflict, they just don't participate in discussions. Sometimes, amazingly, they had to deal with a call of nature at the time the vote was held. But there is a Form 8B and a copy of that's in here. Again, if you have a specific question regarding specific facts, that's always the best way to deal with it. Usually when we talk about this at bar meetings, this is an hour-long discussion just on that, and we get about an inch worth of paper. One thing I will say, there's 4 hours. I'll make sure that Marcia has the link, but they've broadened the groups that have to take the ethics this year. So I believe it's going to cover all board members. So it's a 4-hour ethics course. And, you can either pay to take it or there are recordings of it that are fine that will go over the specific ethics issues. And I think the course has to last 4 hours. Again, if there's no questions or I haven't sufficiently put you to sleep.
On that course, so that's a requirement now, or you're saying that's coming?
No, it's a requirement. It's something the legislature did this year to expand it. It had dealt with elected officials, now it deals with public officials, and y'all are public officials.
So now at the end of the year, by December 31st, you'll have to take the same ethics course that I've had to take and Kim's had to take. I don't know about the judge.
The county will provide a link to you to take it.
Right.
Yeah.
Yeah, that's what he's saying. He's gonna give us the link.
Yeah, it is good stuff regardless. It's just that for whatever reason, they have expanded the reach. You know, why the legislature does anything in any given year, I couldn't tell you. But that's just something they've done that in my perusal of statutory changes, which I'm still working on. Ms. Ashley, I came across that was one of the things that the governor had signed into law, and it expands it because several of the people here will already take their version of it. But this will cover the referral appointments clearly.
That's it.
That's it.
Thank you so much. And Member Chance, if you have any questions or concerns, don't hesitate to reach out to Attorney Swain, even outside of the meeting.
No, by all means, you can get in touch with me. Mark has my cell phone and my office phone, and I'll be happy to take phone calls at any time.
Thank you. I appreciate that.
Any board members have any questions for Attorney Swain? Thank you. Thank you. We'll go now to our ED report, and then we'll go do our general public comments after that.
Thank you, Madam Chair. To be brief, really, my report was just a thank you to our providers. As you know, we have just completed all of our camps for the summer, and we had a great summer. Lots of participation and engagement, and I think I was able to visit several, a lot of happy children and youths. And so if you will give me a moment, I would like to read the names of all of our camps, just to acknowledge them and the work that they did this summer. Alachua County Camp Cuskawilla, the Boys and Girls Clubs, the Cave Museum, City of Alachua, Community Impact, Cultural Arts Coalition, Deeper Purpose Community Church, Gainesville Area Tennis Association, Gainesville Circus Center, Girls Place Inc., Good News Art, I Am STEM, Just for Us, Kids Count in Alachua County Inc., Santa Fe College, Greater Duval, St. Barbara. There's more to St. Barbara.
Leadership Institute.
Thank you. St. Barbara Ministries. The Star Center Theater, Traveling Art Camp, YMCA, UF Crop, Greater Bethel AME Church, and Freedom School. And then lastly, I'd like to include in their teens work. So I just want to say thank you to everyone that was a provider that cared for our kids, our youth, allowed us to come out to their sites for our site visits, and just participated with the trust this summer. Thank you, one and all. That is it, Madam Chair.
Thank you, Ms. Kiner. Do you have a round number of approximate number? How many we touched? No, Teamworks was 200, right? Right at 200.
It would have been 220 for teens work.
We had some count that went to the beginning of the school year.
Yeah.
Yeah. I was just wondering, just a round number, if we thought.
I guess
it sound like at least 400. At least. Thank the staff. I know it was a Herculean task with monitoring the camps and visiting and the invoicing that'll start coming in, now, and the providers for serving during this great hot summer that we had. It went real fast, but it was hot out there. I'm gonna tell you, man, it was hot. That's all I can say. This is this new heat. I don't know how to deal with it, and it's new heat. And anyway, but thank you all for the staff and for the providers for delivering service to our young people this summer. Okay. We just have one thing in the binder, that certificate from Grace to Overcome is in there. I won't go over that, but we're now back to our general public comments for any member who didn't get to comment earlier or who's here and would like to come greet the board now. You'll have 3 minutes to come and speak with us. If you come, please give your name, speaking to the mic.
Good evening, John Rollins, Motivate You, President and CEO of Motivate You North Central Florida. And first of all, I want to say thank you all for contracting with our organization as an enrichment provider. September of 2022, I came to a board meeting and I made a request of, or I inquired on how some of the unallocated funds were going to be used. We were told that there was be a strategic plan would be informed on what the next steps were. This since October 1 up to current, we have conducted 276 programs. I mentioned that because we were allotted 200 under the contract. So that means that we did programs where we had to go outside and secure funding, and we were able to do so. I'm grateful for that. We also served since October 3,629 of our youth, which I think is not bad. Okay. Because of summer camp, we normally involve ourselves with many of the camps, and so many of them that you listed and thank for offering camps, we went out and served or partnered with them to make sure that they had activities for the children. With that being said, we're about to exhaust our 200 allotted, and we did get some additional through the cost of living. So we did get, I think, another 11 programs we're able to offer. But today, we had a conversation with one of our schools who was requested that we come out and do 5 programs a week year round. I know that the contract starts again in October. We have the city of Gainesville who has requested that we go out and do after school programs for each of their recreation facilities. And so if we just did those programs alone, we will exhaust and then run into a deficit of our contracted programs. I know that it won't be decided today, and I know that we can't renegotiate until after this contract year expires. Okay, but if there are any way possible for organizations who are out in the community serving the needs of those individuals, if there's any way possible for them to be researched, reviewed, have some discussions, I think that Motivate You would be one of those agencies who is out serving, meeting the needs, serving our children. And we could, if we had more programs, we could serve more students. So I don't know how those discussions can take place, but I'm coming back on the record to say that there's a lot more that we can do if we can get some more support from the trust. Thank you all.
Thank you, Mr. Rollins. I think I'm gonna suggest that you meet with whoever the staff. I'm not gonna put him on Edie Connor, so I'm not sure which of your staff members you would do that, but he reached back out to you all and do the proposal thing, and you all try to figure out something. And okay.
And we can bring back a
Okay.
recommendation.
Yes, do that. Okay. So Mr. Rollins, you can take care of that. Anyone else? Any other public comment? Okay, seeing no other public comment, I'll bring it back to the board for board member comments or whatever. And remember, Chance, at the beginning of the meeting, you were asking for a space that you wanted to share some things. So if you have,
Oh, no, that was just a conversation for another day. No, I don't have anything.
you don't have it, okay, you don't want to share. Okay. Any other board member?
Thank you.
Any board members have a comment? Any? All right, y'all, everybody ready to go? Ready to go. It's been a long meeting. Well, we thank you all for coming. It's not often that we get together and we do what we did. Today we had the workshop prior to our regular meeting, so we could have some additional time with staff, and then we had our regular meeting. So that was an anomaly. And if no one else has anything else, does staff have anything that you need to share with us? It's not on our agenda, future dates or anything like that. All right, so we'll consider ourselves adjourned. All right, thank you all.
Good job.
Thank
A
you.
lot of work.
All right.
Thank you.
Thank you.
All right.